Good morning, ladies and gentlemen. Welcome to the YouTube channel of the National Institutes of Health, Ministry of Health, Malaysia. My name is Dr. Tanya, and I am from the Institute for Public Health, and I will be your moderator for today's CME session. The links for attendance registration and submitting questions are available in the description below. Please do not forget to register in order to receive your certificate via email. We will begin today's CME session with a corporate video from the Institute for Public Health, IKU. Let's take a look.
Malaysia is currently facing the double burden of communicable and non-communicable diseases, together with lifestyle risk factors, which pose devastating consequences on population health. Population-based data is vital for monitoring of health status of our population, while indirectly evaluating various strategies and programs implemented by the Ministry of Health. The Institute for Public Health, or better known as IKU, is one of the research institutes under the National Institutes of Health, Ministry of Health Malaysia, that spirits national epidemiological research, with the goal of supporting evidence-based policy making, through public health research and regular population-based surveys.
We started as a training institute in 1967 and changed our main focus to research in 2005 with the establishment of the National Institute of Health, NIH. As one of the research institutes under NIH, our main functions are conducting research, training and consultancy. Our niche area is community-based survey, and we are well known for our National Health and Mobility Survey, or better known as NHMS. These surveys were done at regular intervals since 1986, targeting different topics and target population.
IKU aims to strive further to become a leader in health survey in Malaysia, and to achieve this, IKU formulated 6 key strategies. IKU value knowledge as a commodity to be shared and continuously disseminate the research findings. IKU disseminate research findings to the stakeholders through various presentations, technical reports, fact sheet highlights, and infographics. At the same time, IKU published a research findings in various scientific journals and presentations at scientific conferences.
Our officers also provide consultancies in various research-related areas. For this, I'm proud to note our expertise were recognized by numerous agencies locally and internationally.
In ensuring to provide a comprehensive health-related population-based data, IKU established 7 centers that mirrored image public health divisions at the Ministry of Health. Family health, communicable disease, non-communicable disease, nutrition epidemiology, burden of disease, occupational health, survey research.
NHMS scopes were based on either age groups such as maternal and child, adolescents, and older persons, or health-related scopes such as non-communicable diseases, communicable diseases, and nutrition.
Apart from that, IKU also conducted other national survey and burden of disease study. IKU is also actively involved in interventional study, also conducted development and validation of new research tools, as well as a systematic and scoping review.
To produce quality research, we must adopt cutting-edge technologies. Facilities in IKU are equipped with research-critical equipment and systems to ensure that we produce quality research output.
Through the years, IKU has significantly enhanced its capacity as a research institute. IKU achievements can be seen through his contributions to the key performance indicators set by the top managements. We strive to be the center of excellence in epidemiological and survey research through conducting high-impact research in supporting the Ministry of Health for evidence-based policymaking.
Welcome back, viewers. Without further ado, I am pleased to introduce our speaker for today's session, Behind the Scenes of NHMS 2023, From Proposal to Policy. Ladies and gentlemen, we are honored to have with us Dr. Haliza Matrifin, a medical officer from IKU, and most importantly, the principal investigator of the National Health and Mobility Survey NHMS 2023, Non-Communicable Diseases and Healthcare Demand. Dr. Haliza holds a medical degree from Cyberjaya University College of Medical Sciences as well as a Master's in Public Health from the University of Malaya. In addition, she also has a bachelor's degree in information technology. Dr. Haliza is here to walk us through the journey of NHMS 2023 from the initial proposal all the way to its influence on national health policies. We hope this session will offer invaluable new insights and reveal a fresh perspective on NHMS 2023 like never before. Thank you, Dr. Haliza, for being with us today. We are very much looking forward to your presentation. Over to you.
Okay, thank you, Dr. Tanya, for your kind introduction. Assalamualaikum and good morning, everyone. And thank you for joining us online today. As mentioned by Dr. Tanya earlier, my name is Dr. Haliza binti Matrifin, the Principal Investigator of NHMS 2023 on Non-Communicable Diseases and Healthcare Demand. So today, I'm excited to share with you from proposal to policy, behind the scenes of NHMS, from proposal to policy. So, let me draw your attention to this headline. Rakyat Malaysia semakin gemuk, seorang daripada 6 kanak-kanak mengalami masalah kesihatan mental dan lebih setengah juta atau 2.5 daripada penduduk di Malaysia menghidap gabungan 4 penyakit tidak berjangkit iaitu diabetes, darah tinggi, kolesterol tinggi dan obesiti, dan lebih separuh daripada orang muda tidak sedar ada kencing manis. So, ever wondered who's behind this number? These numbers are quoted everywhere, in the news, in policy discussion, and maybe on our Facebook scroll. But have you ever stopped to ask, where do they come from and who goes out to collect this data? So what you are looking today is just the tip of iceberg. Today, I'll take you behind the scenes of NHMS 2023 so you get to see what it really takes to generate this number.
Wow, Dr. Haliza. Oh, that was alarming to know. Speaking of NHMS 2023, Dr. Haliza, could you walk us through how the survey was first initiated and what goes into planning and implementing a study of this magnitude? In particular, like during the pre-data collection phase, how did you go about selecting topics to be included in the survey? And were there any key considerations involved in that process?
Well, thank you, Dr. Tanya, for the question. All the questions will be addressed during my presentation on pre-data collection phase. So, before I take you behind the scenes of NHMS 2023, let me briefly share with you the history of the survey. The National Health and Mobility Survey, or as known as NHMS, is a nationwide population-based survey that has been carried out by IKU, or Institute Kesihatan Umum, since 1986. So its main goal is to provide up-to-date information on country's disease burden, health issues, healthcare needs, and also health expenditure. Since 2011, NHMS has been conducted annually in 4-year cycle. So the first year of each cycle focuses on non-communicable diseases, their risk factors, and healthcare demand, while the following years cover other key health areas as determined by Ministry of Health. NHMS 2023 marked the 7th cycle of NHMS NCD and healthcare demand, and starting in 2023, NHMS has moved from a 4-year cycle to a 5-year cycle. So I would like to divide my sharing session into 3 phases pre-data collection phase, during data collection, and also post-data collection phase. So now, let me begin with pre-data collection phase. So as you can see at the bottom of the screen, there were 10 key activities involved, starting from the scope selection to proposal development all the way to pilot tests. So now let us move to the first step, which was the scope selection process. So the content of NHMS isn't decided in a silo. So in January 2022, we reached out our stakeholders from all relevant divisions under Ministry of Health in order to propose what they felt most important to include. So in return, we received 42 scope suggestions, and emphasis was placed on streamlining the topics based on main scope of NCD and healthcare demand. And the research team from IKU then conducted a thorough literature search and prepared evidence tables to identify, justify, and select the appropriate scope for the survey based on specific criteria. So I will explain about the specific criteria in the next slide. And after the process, several discussion and engagement with stakeholders will help to justify all the scope. So there were about 16 main scope identified in NHMS 2023, and the final scope then was presented to the NHMS Steering Committee chaired by our Director General of Health. So criteria used for scope selection include relatively high prevalence currently or in future, focusing on disease or disorder associated with affluence, lifestyle, environment, and demographic changes, causing significant physical, mental, or social disability, have important economic implication, information not available through routine monitoring system or other sources, feasibility of implementing intervention, information more appropriately obtained through a nationwide community survey, and feasibility of obtaining information through a nationwide community survey. So these are among the criteria used for scope selection. So if you can see on the screen right now, these are some of the photos taken during NHMS Steering Committee 2022, chaired by our former DG Tan Sri Datuk Sri Dr. Nur Hisham Abdullah. Now, moving on to the next step, which was the proposal development. So in the next few slides, I will explain about the content of the proposal. So if you can see right now on the screen, in total, there were about 16 main modules included in NHMS 2023. So data collections was performed via validated questionnaire, clinical assessment, and blood investigation. So a key person was appointed to lead each module where they required to engage with relevant stakeholders to discuss on the content of the module. And for NHMS, NCD, and healthcare demand, we typically collaborate with Institute for Health System Research or IHSR with the healthcare demand module led by their team. So our objective covered NCD prevalence, their risk factors, and also healthcare demand. So moving on to sampling designs. This survey was a cross-sectional population-based survey, and planning as an NHMS isn't just about choosing what to ask. It's about ensuring the data is representative of the population in Malaysia. So after the calculation of sample size, we allocated the national sample proportionately across all 16 states and federal territories in Malaysia based on population size. We then applied a two-stage stratified random sampling method. So first, 499 enumeration blocks, or EBs, or we can say as area, were selected across urban and rural areas in all 16 state and federal territories in Malaysia. Then, 12 living quarters or houses were selected per EB. The selection was done by Department of Statistics Malaysia. And in total, Tanya, there were about 5,988 living quarters were sampled. That's a lot of doors to knock on. So after a proposal was developed and submitted, we then presented it to JPP NIH, Jawatan Kuasa Penilaian Pendidikan NIH, and obtained approval from Medical Research Ethics Committee. So as expected, we followed all the key ethical practices. Informed consent and data protection were central from the start. For us, earning and protecting respondent trust is absolutely essential. So now, moving on to the next stage, which was the questionnaire design stage. So in this stage, we identify and listed all the questionnaire that going to be used for our survey. So if you see on my previous slide, the questionnaire were adopted from various multiple validated sources. For example, like WHO STEP for NCD, Global Physical Activity or GPAC for Physical Inactivity Module, PHQ-9 or Patient Health Questionnaire, 9 for Depression Module, Modified CAT for Tobacco, and many more. So if you can see on the screen right now, these are among the photos taken during the questionnaire workshop with the stakeholder. So in this workshop, we discuss and justify on the questionnaire that need to be used for our survey. So in addition to the activities that I have mentioned earlier, we also conducted a pre-test and cognitive debriefing in January 2023 to evaluate the clarity of the additional questionnaire. So at first, key person involved received pre-test training, and then during the pre-test, 30 respondents per module had participated. So the research team then reviewed the feedback given from the respondent and made necessary adjustment to the questionnaire wording to improve clarity and understanding. So now moving on to next stage, which was the red cap system pre-testing. So since this was our first time using red cap for data collection, especially offline, it was quite a challenge to ensure the questionnaire flowed smoothly with right skipping pattern. But thankfully, finally, our team managed to get everything sorted in time. So if you can see on the screen right now, these are some of the screenshots from the offline red cap system which we use to collect data from the respondent in the field. So another important pre-data collection activity was meeting with liaison officer chaired by our director to ensure smooth coordination before and during data collection. Appointed by State Health Department, these officers work with district health officers and help share survey information with selected communities. They also acted as the key contact, or we can say as a middle person between the state and also IKU to support the survey process. And as you can see on the screen right now, we conducted online briefing session with liaison officers from all the states in Malaysia. And in a few states, our teams even visited the State Health Department in person to present about our survey plan.
I'm sure many of us didn't quite realize how extensive and meticulous the whole process behind conducting the NHMS really was. It is truly impressive to learn about the planning, coordination, and effort that goes into making a study of such a scale a success. So, Dr. Haliza, all of this sounds good in theory, but how did you actually prepare and conduct the data collection on ground level? Can you elaborate something on that?
Okay, thank you, Dr. Tanya. I will answer that in my next few slides. So, first, it was the movement plan. Movement plan was a crucial part of data collection process and had to be carefully organized during pre-data collection phase. So each state's movement plan was prepared by field supervisor, or as known as FS, mostly appointed from Institute for Public Health, and one FS from Institute for Health Behavior Research, or IPTK. This plan were then presented to our director during the movement plan presentation session to assess feasibility, and adjustment were made as needed. And as shown on the screen right now, is one of the key challenges that we faced was the uncertainty surrounding the exact date of state election in some of the states in Malaysia in 2023. And to avoid disruption, we need to revise our approach in where we actually collected data in non-election state first, then only moving to election state once the election were over. So the next step was the logistic preparation. So logistic was a crucial part of pre-data collection phase. So in this photo, you can see some of the items prepared for each team before data collection took place. And in the video, you'll see our team hard at work, packing and getting everything ready to send to temporary storage site in the state. Okay, so now the next step or next activity was data collection training. So data collection training where all temporary data collectors or my staff, nurses, assistant medical officer, and also field supervisor were required to attend a 7-day comprehensive training session. So the goal was to actually ensure consistent, standardized, and effective data collections in the field. So we started with in-house training for field supervisor in June 2023 at IKU, followed by regional trainings from 4th to 10 July in Sabah and Sarawak, and 12 to 18 July in Peninsular Malaysia. The training covered survey content, field procedure, and team roles. So it included briefing, simulated interviews, and supervised practice. Nurses and assistant medical officer were also trained on clinical assessment, how to handle devices and perform quality check on the devices, and refer guidelines. Data collectors also receive hands-on training using RedCap, especially for accurate entry of respondent ID numbers and other data into our RedCap mobile system. So after the training, we actually carry out a pilot test data collection to test the process on the ground, and where all the feedback during pilot was obtained to be corrected before the actual data collection took place. This was to ensure the smoothness of our actual data collection. So, Dr. Tanya, I have covered the activities involved in pre-data collection phase. So, in order to increase response rate from the respondent, publicity efforts was done. So if you can see on the screen right now, some of the publicity efforts included the official launch of the survey by our former Honorable Minister of Health on 14 July 2023, which received a mass media coverage. A mini exhibition was also held alongside the launch to help better understand the survey. So here are some of the photos from the event. So the publicity team from IKU also worked closely with Ministry of Health Corporate Communication Unit or UKK to manage publicity through various media channels, including social media and television. And at the state level, liaison officer from State Health Department helped with local publicity. So state liaison officer or field supervisor arranged media interviews and other promotional activities. And to boost public awareness, NHMS 2023 also used social media platforms like MOH Facebook and Instagram pages. So if you can see on the screen right now, here's the pamphlet that was distributed to the selected EBs and living quarters. And in the next slide, I will show you a video we shared with our respondent or community leader or ketua kampung to convince them about our survey. So now let us watch the video.
Tinjauan Kebangsaan Kesihatan dan Morbiditi atau lebih dikenali sebagai National Health and Morbidity Survey NHMS telah mula dijalankan semenjak tahun 1986. Semenjak itu, NHMS mula dijalankan sekali setiap 10 tahun. Bermula tahun 2011 hingga kini, NHMS dijalankan mengikut tema khusus setiap tahun. Kes penyakit tidak berjangkit NCD seperti kardiovaskular, kencing manis, darah tinggi, diabetes, kanser dan stroke dikesan semakin meningkat di negara ini. Dianggarkan 1.7 juta individu dewasa di negara ini menghidap 3 penyakit NCD. manakala 3.4 juta individu dewasa pula menghidapi 2 penyakit NCD atau mempunyai faktor risiko utama. NHMS 2023 pada tahun ini memberi fokus kepada penyakit tidak berjangkit atau Non-Communicable Diseases NCD. Tinjauan NHMS kali ke-7 dijalankan untuk melihat kembali isu-isu berkaitan penyakit tidak berjangkit dan permintaan jagaan kesihatan seperti kencing manis, tekanan darah tinggi, paras kolesterol tinggi, aktiviti fizikal, merokok dan penggunaan tembakau, pengambilan alkohol, kesihatan mental dewasa dan kanak-kanak, permintaan jagaan kesihatan serta topik-topik yang berkaitan. NHMS 2023 yang dijalankan di seluruh negara ini akan melibatkan anggaran 21,000 orang responden, 6,000 buah rumah yang terpilih secara rawak oleh Jabatan Perangkaan Malaysia. Dengan bilangan pasukan pengumpul data seramai 36 pasukan, iaitu 27 Semenanjung Malaysia dan 9 pasukan bagi Sabah Sarawak. Setiap pasukan akan dianggotai oleh pegawai, pembantu penyelidik dan jururawat. Kenali pasukan pengumpulan data kami. Setiap ahli pasukan akan lengkap berpakaian vest rasmi IKU beserta tag nama yang menaiki kenderaan berpelekat NHMS 2023. Pasukan kami disertai oleh jururawat beruniform. Anda boleh mengesahkan identiti ahli pasukan melalui surat lantikan atau layari laman web rasmi IKU. Pengumpulan data yang dijalankan di rumah-rumah terpilih mengikut kesesuaian tarikh dan masa yang telah dipersetujui bersama. Pengumpulan data ini melibatkan aktiviti-aktiviti seperti temu ramah bersemuka, soal selidik kendiri, penilaian klinikal iaitu pengambilan berat badan dan pengukuran tinggi, pengambilan darah di jari bagi penilaian kandungan gula dan kolesterol, temu ramah melalui telefon. Data-data yang diperolehi daripada anda akan mewakili rakyat Malaysia dan akan dimanfaatkan bagi menggubal polisi dan langkah-langkah penambahbaikan terhadap program-program dan penyampaian perkhidmatan kesihatan di Malaysia. Maklumat yang diperolehi daripada tinjauan ini akan disimpan dan dikendalikan secara sulit. Semua maklumat ini hanya akan digunakan untuk tujuan tinjauan dan penyelidikan sahaja. Maklumat lanjut mengenai NHMS 2023 boleh diperolehi dengan melayari laman web. Hubungi kami di talian 03 33 62 8787 dengan masa operasi 8 pagi hingga 5 petang. Terima kasih atas kerjasama anda. Marilah bersama-sama meningkatkan taraf kesihatan rakyat Malaysia.
Okay, now, as I already explained about pre-data collection phase, now let us move on to during data collection phase. So, I will only focus on field data collection as Dr. Sarah from IHSR already had her sharing session during NIH CME last year on healthcare demand module using CAR-T. So, for field data collection, it was conducted from 11 July till 29 September 2023, and each data collection session took approximately around 40 minutes to 1 hour to complete. And for NHMS 2023, we mobilized 36 teams, 27 teams in Peninsular Malaysia, and 9 teams in Sabah, Sarawak, and Labuan. So among the method used for our data collection, as mentioned in the video just now, include face-to-face interview using computer-assisted personal interview using tablet, self-administered questionnaire or SAQ via hard copies. This is for some of the sensitive questionnaire, include alcohol consumption and also mental health questionnaire. And then anthropometric and clinical assessment, and also blood investigation using point-of-care testing devices. So as you can see on the screen right now, Each role had a clear task. For example, like liaison officer from the State Health Department coordinated with district health officers and helped relay survey information to selected communities. And then district health officers then helped to raise awareness in selected areas through pamphlets and initial site visit. So meanwhile, for supervisor, their role include to deal with LO, supervise team, manage transport, lodging, and finances. And then for data collection team, each team on the ground was led by a team leader, supported by another research assistant, a nurse or medical officer, and also a driver. So everyone had a part to play to keep things running smoothly. So an interview was considered unsuccessful if the respondent either refused to participate or was unavailable after 3 separate visits, or if a language barrier prevented communication. And now let us watch the launching of data collection video.
Thank you, Dr. Haliza, for sharing all those videos. I'm sure those videos provided a great glimpse for our viewers on how the data collection was actually carried out on ground level. In relation to the video that you showed, what were some of the key challenges that you or your team faced during the data collection process? And how did you manage to overcome all those obstacles along the way?
So among some of the key challenges that our team actually faced during data collection, okay, first of all was bad weather, especially floods. So which made it hard for our team to reach certain areas, and also heavy rain. So it actually affected our data collection activity. So what our team did was actually, if there's a selected EBs in the nearest affected area, so they will actually go to the area first and then proceed with data collection. And after the bad weather, like flood and heavy rain was over, then they went back to the affected area. So another challenges that we faced was the refusal from the respondent, especially in the urban setting. So actually, because they concerned about the privacy and thought we were scammer. So in order to overcome this, we need to work closely with local community leader or joint management body for gated community in order to run multiple engagement sessions. So this actually helped to build trust and encourage more people to take part. And apart from that, we actually uploaded our data collectors photos on NHMS website. So this actually can increase our response rate. So other challenges, okay, some of this team maybe, they were chased by dogs, so we actually provide the umbrella to the data collectors to actually protect themselves. And then other key challenges include also technical problems like poor internet connection for real-time data transfer. But we were actually prepared with offline red cat system and data sync method. So our team actually could continue doing the data collections. So we also had to deal with car breakdown and also device malfunctions. But we had backup transport and spare devices ready to avoid delays of our data collection.
Okay, so Dr. Alisa, I just want to ask, were there any tokens given to the respondents?
Oh yeah, actually for NHMS 2023, we gave token of appreciation in the form of jute bag to the respondent after they actually completed our survey. Yeah,
I see. Okay.
So now, I want to share with you a video of our data collection. So if you can see in the video, it shows some of our data collection activities from some of the data collection team in the field, starting from informing the local police station about our presence in the area and also our survey activity to putting up banners and approaching respondents. So if you can see right now, was the first team from Team Selatan, which covered Johor, Melaka and Negeri Sembilan. Okay, now let us watch the video.
Masa sudah pun tiba, panca kuasa, engkau tetap legenda, api kita. Wujud pantas, jangan lemas. Wujud pantas, jangan lemas. Bersama kita berjuang. Bersama kita tentukan.
Yeah, they even actually collected data at night. Yeah.
Dari mimpi hingga reality, kita masih di sini.
So now is a central team that cover areas in Selangor and Kuala Lumpur, one of the central team actually. So now, currently what you're seeing now is Sabah team, where flooding in certain area made it difficult to reach respondent. But they actually went through the flood just to approach the respondent.
Okay, thank you for showing us that video, Dr. Haliza. I feel the video really detailed out all the challenges that the team faced, like, standing under the hot sun and facing rejections and in the floods and under the rain as well. I'm sure the viewers, those who are, watching all this for the first time, would have been really amazed at how you actually collect data at ground level. In relation to this video, I noticed that it was a complex but well-coordinated effort, and your team managed to adapt and stay resilient throughout the entire process. And I'm sure you would have received a lot of data that you mentioned just now, that you collected data using a tablet through the RedCap system. So at your level, did you monitor the progress of the data collection? And were there regular meetings or monitoring on your side?
Okay, Tanya. I will answer that in my next few slides. Okay, now let us proceed with Central Coordination or CCT. So the CCT meeting was held weekly throughout the period of data collection to monitor and evaluate the progress made by each team. And the director of IKU chaired this session where team movement, field progress and logistical challenges, response rates and publicity were monitored. So during CCT, also preliminary data was presented and any missing data, outliers and discrepancy were identified by our data managers and verified with field teams to ensure data accuracy. So if you can see on the screen right now, is the screenshot of our online field monitoring board that was monitored weekly by our CCT. So FS is responsible to update the progress in the field weekly before CCT. Okay.
It was truly interesting to see what actually happened quite literally behind the scenes, like the data collection and also your own monitoring using the monitoring board and having regular meetings as well. So after completing the data collection, what was the next step? Considering that this is a national survey with numerous data from respondents, how did you and your team handle and process such large volumes of information? Could you elaborate something on that?
Okay, thank you, Dr. Tanya. I will answer your question in my next few slides, which is during post-data collection phase. Okay, now we have completed, I've completed my sharing session during pre-data collection and data collection phase. And now let me move on to post-data collection phase. So to answer your question, yes, after data collection, the next step included data cleaning, validation and storage. And data management teams conducted quality checks and analysis, ensuring the data was reliable before reporting. So it was a coordinated effort to handle the scale of national survey. So the data actually was analyzed based on each module objective, working definitions and dummy table, and we employed a complex sampling analysis procedure with 95 confidence intervals. And now let me move on to response rate of the survey. So I've mentioned earlier, there were 5,988 living quarters were selected, and of this, 5,006 living quarters were successfully visited, giving the response rate of 90.1. And from this 5,006 living quarters, 13,616 respondents were successfully interviewed, giving the response rate of 92.3%. And the overall response rate of this survey was 83.2%. So from the 13,616 respondents that were successfully interviewed, most of the respondents were from urban localities, female and of Malay ethnicity. So as mentioned earlier, we use complex sampling analytic method considering sampling, non-response and post-stratification weights. And after adjustment, if you can see on the screen, the distribution of our respondent by sex, ethnicity, and age group closely approximate to the distribution reported by DOSM, as shown in the third column of the table and also on the population pyramid in the next slide. So here are some of the photos taken during data analysis and report writing workshop with our stakeholder. So the next step after completing the data analysis is the dissemination of finding. And the findings of the survey were presented in various channels, including to the stakeholder via online physical meeting, NHMS steering committee chaired by our former DG, Dato' Dr. Muhammad Razi Abu Hassan, and also a pre-council session with our YBMK. So one of the way we shared the finding with the public was through an official launching ceremony in which reporters from various media outlets were invited to cover the event and highlighted the key findings from the survey. So if you can see on the photo right now, our YBMK our former DG and also our director were holding our key findings and also fact sheets during the launching. So this launching of findings was also done with a global adult tobacco survey project.
Ini merupakan pelancaran
Okay.
dapatan
This is
NHMS
the video
National
of the
Health Mobility
official
Survey
launching ceremony of the
2023
findings
bersekali dengan
taken
itu, the Global
from
Adult
our YBMK
Tobacco
Facebook.
Survey.
So let's take a look at the video.
Satu kajian yang sangat penting ya, yang bakal menentukan bukan saja mengetahui akan status kesihatan rakyat, tapi lebih penting daripada itu akan menentukan ya, hala tuju dan juga polisi-polisi kesihatan awam. Perkara yang penting sebagai dapatan ya adalah pertama adalah prevalence NCD terutamanya dalam kelompok muda ya, diabetes, kencing manis. NHMS 2019 18.3%. NHMS 2023 menunjukkan penurunan 2.7%. Kedua adalah darah tinggi. NHMS 2019 30%. NHMS 2023 penurunan sebanyak 0.8%. Ketiga adalah kolesterol. NHMS 2019 38.1, ini menunjukkan penurunan sebanyak 4.8%. Cumanya untuk saya tekankan yang mustahak prevalence NCD untuk golongan muda bawah 40 tahun adalah meningkat. Dengan pengesanan awal ataupun saringan dan intervensi ya, usaha-usaha yang telah kita lakukan di kementerian ini, mustahak juga untuk kita perhatikan untuk ke depan nanti, budayakan gaya hidup sihat dan mencegah penyakit. Kedua, saring dan kawal penyakit sejak awal. Dan ketiga adalah pengetahuan ataupun tingkatkan literasi kesihatan. Diabetes, darah tinggi dan kolesterol semuanya mengalami penurunan, tetapi prevalent berat badan dan obesiti dalam kalangan dewasa meningkat. So this one is climbing up. Dan salah satu faktor penyumbang kepada meningkatnya masalah ini adalah pengambilan gula secara berlebihan. Bagi membendung masalah ini, KKM telah melaksanakan beberapa pendekatan ya. Pendekatan fiskalnya adalah pengenaan cukai excise kepada minuman bergula dan minuman pracampuran. Seterusnya, kempen advokasi mengurangkan pengambilan gula secara besar-besaran akan dilaksanakan. Kajian Global Adult Tobacco Survey GATS 2023, Malaysia menunjukkan peningkatan penggunaan rokok elektronik atau vape. Akta Kawalan Produk Merokok Demi Kesihatan Awam 2024 ataupun Akta 852 telah pun kita gazetkan Februari 2024 tahun ini untuk mengekang penggunaan produk tembakau serta mengurangkan kemudaratan akibat merokok ya. Cumanya penguatkuasaan Akta 852 ini ia berserta peraturan dan perintah insya-Allah akan kita laksanakan bermula Jun 2024. Dalam Akta Kawalan Produk Merokok dia juga adalah Akta Kawalan vape. Jadi itu yang nak saya sebutkan sebagai highlightnya.
Okay, now I would like to share a video on some of the key findings from our survey. Okay, apart from presenting the findings to the stakeholder, we also held a 2-day seminar to discuss the findings in more details. So it was a great platform for researchers, policymakers, and other stakeholders to exchange ideas, ask questions, and talk about possible next steps based on the findings. So the details of the finding can be downloaded from our website in the form of fact sheets, infographic, and technical reports. So you can type iku.gov.my/NHMS-2023. So besides the technical report, fact sheets and key finding, we also came up with a few research highlights for a certain key topic. So the idea was to zoom in on specific issues we found in the survey and share them with stakeholders, along with some recommendations they could use to take action.
Thank you for providing our viewers with those visual insights to help deepen their understanding of this topic. So, Dr. Haliza, could you share how all these data has been used in addressing non-communicable diseases? What kind of policy changes or were there any strategic recommendations that have been brought about as a result of the findings of NHMS 2023?
Okay, Tanya, thank you for your question. I will answer that in my next slide. So if you can see on the screen right now, one of the key finding policies developed based on NHMS 2023 is War on Sugar. So this public health initiative aims to reduce sugar consumption among the population in Malaysia in response to the high prevalence of diabetes and obesity. It also focuses on increasing public awareness, promoting healthier food choices, and encouraging individuals to reduce their intake of sugary drinks and snacks. So in support of this effort, the Plan Strategik Mengurangkan Gula dalam Kalangan Rakyat Malaysia 2024 to 2030 was developed and officially launched on 29 June 2024. So this plan consists of 6 main strategies with 38 initiatives and 65 activities covering policy, advocacy, and public-private partnership collaboration through a comprehensive whole of society and whole of nation approach. So, on a more local level, Plan Strategik Putrajaya Sejahtera also was developed using some of the findings from NHMS 2023. So, it's a comprehensive health and well-being plan tailored for the civil servant in Putrajaya, focusing on improving lifestyle behavior, managing NCD risk factors, and also create a healthier urban environment. So it shows how NHMS data is being used, not just nationally, but also to drive local actions. So there are also many upcoming policies currently being developed based on the survey findings that are going to be released later.
Thank you, Dr. Haliza, for that insightful presentation. We will now move on to the Q&A session. So the questions have been submitted by our viewers through the online platform, and I will be selecting a few to pose to Dr. Haliza. Let's get started with the first question. So we have here from one of our viewers, the person has asked, can online surveys fully replace traditional survey methods like face-to-face or telephone interviews? So what they're asking is, instead of going to house and knocking on the door and asking people to answer the survey, can it be transformed into a fully online survey? Is that possible, Dr. Haliza?
Yeah, I would say in my opinion, my personal opinion, for now, no, because although online survey is quick to administer and then cost effective and reach, I must say, what range of respondent, but we must always take into consideration that NHMS is a national representative data. So it needs a representative data which cover the rural area. So let's say because we need to reach out the rural population. So the limitation of online system is that if there is any poor internet connection in the rural area, actually we cannot get the response rate from the respondent in the rural area. So it makes our response rate low in that rural area, and it cannot be nationally representative because lack of rural population in the area. And then another point is that I must say some of the method used in our NHMS like clinical assessment and also blood investigation still need physical physical appearance. So by using online survey, I don't think it's possible for survey like NHMS. And the other thing is about data quality, because for example, like online survey, the respondent cannot actually clarify straight to the straight away to the interviewer. Where else, if you use face-to-face interview, you can actually clarify the questionnaire with the interviewer, and same goes to phone interview. So you can just straight away clarify with the interview. So that is my answer for the question given. Okay.
Very well understood, Dr. Haliza.
Yeah.
Thank you for your answer. We will take the second question. Okay, so this viewer has asked, what are some of the national and global health indicators that used NHMS data?
Okay, some of the global and national indicator that use NHMS data include SDG or Sustainable Development Goals, universal health coverage, and local, at national level, NSP, NCD. So, for example, like universal health coverage, some of the indicator include age standard prevalence of raised blood glucose, overweight and obesity, and then raised blood pressure and others. And then SDG, I think under SDG 3, under SDG 3.A, so there were indicated like age standardized prevalence of current tobacco use. So these are among the indicators used at the global level. Meanwhile, for at national level, indicators such as NSP NCD or National Strategic Plan for NCD, some of the indicators that use NHMS data include prevalence of diabetes and obesity, raised blood pressure, physical inactivity, harmful use of alcohol, and also tobacco use. Okay.
Okay, thank you, Dr. Haliza. Actually, yeah, we can see that the NHMS data has really been used well locally and also internationally. Thank you. So, ladies and gentlemen, we have come to the end of today's CME session on behind the scenes of NHMS 2023 from proposal to policy. On behalf of IKU and NIH, I would like to extend our deepest appreciation to Dr. Haliza Madrifin for sharing her invaluable insights and experience as the principal investigator of NHMS 2023.
Okay. Thank you to NIH CME to allow us to have sharing session today. Yeah.
Today's session has given us a deeper understanding of the rigorous process behind the survey, from the early planning stages to data collection and ultimately its impact on national policies. It has truly highlighted the importance of evidence-based decision-making in strengthening our healthcare system and also addressing the growing burden of non-communicable diseases. To our viewers, thank you for joining us. We hope this session has been informative and has given you a new perspective on the critical role of large-scale surveys like the NHMS in shaping public health in Malaysia. Until next time, stay safe, stay informed, and thank you once again for being with us today. Thank you.